Do you know that 8,500 nursing education institutions are there in India? 3,42,000 nurses are coming out each year. So if you look at a global perspective, India is a gold mine to produce healthcare delivery staffs to the world.
Being a faculty of nursing educational institution, I realized the significance of communication and delivery of high quality nursing care to our patients.
As you all know that previously we all focused towards the delivery or imparting of knowledge in education, whereas it has changed to its next level, that is skill-based practices. Skill-based practices has a important role in nursing education at this point in time.
Sarvodaya group of nursing institutions offering quality nursing education for the past 23 years has come out from this academic year with creation of simulation and skill lab.
In order to compete with the standards and parameters, we newly introducing our simulation lab, that is Sarvodaya simulation lab, to our nursing education.
Keeping this idea in mind, Sarvodaya Simulation and Skill Lab is well structured with task trainers, training mannequins and simulators.
This simulation and skill lab is going to offer the first-hand clinical experience for all our students.
The objective of the simulation lab is to give a high-quality nursing education without harming the patients.
This lab is going to be used for research and other clinical education facilities.
It can also be used by staff nurses to practice varieties of skills which they have learned in order to demonstrate and practice so that they can also improve the quality of nursing care in the clinical area.
So we all know that the nursing education will complete only if the student nurses get a hand skill practices from the hospitals. To avoid or to fill up this gap, we have introduced this concept. Sarvodaya's research and development team constantly working on, to give the best parameters, of the nursing education. So this idea would be the, next milestone in our Sarvodaya's education history. I would, also inform you to all that we will be developing, induction-based courses which will be useful for the frontline nurses who works in a healthcare delivery system.
And the students also get opportunity to learn on themselves and become self-confident without harming the patients as of in the clinical area. Sure, this is going to be a boon for our students, and by this we have Professor Anand, who is going to take a tour of our simulation lab for further information. Thank you.
Welcome all to Sarvodaya Skill Lab. In our Skill Lab, we provide opportunities for our participants and our students to participate and perform hands-on training on various procedures like airway management, cardiac management, neonatal resuscitation protocol, PPH management, trauma management, and various other procedures like choking, and for patients who are in drowning, we support the patients. And also, we also give opportunity to perform procedures like IV cannulation and catheterization for male and female patients. So these provisions will be provided to the participants as well as our students who are in Sarvodaya Skill Lab. And adjacently, we have our Sarvodaya Simulation Lab situated. Let us go and find out what new advancements and innovations are being equipped inside Sarvodaya Simulation Lab. Now, let us see Sarvodaya Simulation Lab. So we are standing at the entrance, and you can see the reception desk here. Our in-charges will be sitting here over the reception desk, and adjacently, let me go to the stations, and here you see the first station, which is the most advanced station. I hope so. We are the first one to launch this station in all over Bangalore and Karnataka. So this station helps the participants and students to study about various emergency situations, and also they can put their hands to find out the vital parameters using this cardiac monitor. And once they connect the accessories to the patient, the vital parameters will be displayed using this controller pad, which will be in the hands of the instructor, that will help the student to understand the proper placement and improper placement of the accessories like pulse oximeter, ECG leads and various other things, BP cuff and other so on things. It not only helps for that, but also it helps for understanding the changes that happens in the breathing pattern and heart rate, and also it supports for airway management and also cardiac management to administer CPR. So these many provisions are there to make the student understand about how to manage the emergency situation. So let us move on to the next mannequin, which is known as Nursing Pro mannequin. This Nursing Pro mannequin has multiple things to be learned using this. For example, you can do an head to foot assessment using this Nursing Pro mannequin. Not only that, I could say there is something which is known as a sim scope. It is alike stethoscope, but here students get a lively experience to listen variations and changes in the heart rate as well as in the respiratory function when a person breathes in. For example, to say a person with asthma, the variations can be easily seen when we are hearing with the help of this sim scope. So the person who is learning will get experience, lively experience, as like they are getting trained in the hospital. And also various other procedures like we can go for performing colostomy care, catheterization, foot care, back care, bedsore care. All these things are possible with this single mannequin, which gives a multiple opportunities for the student and participants to learn over. So with this, we'll go to the other side of the simulation lab. Yes, we'll move here. So the other side of the simulation lab, unlike the Atlas mannequin, which is advanced trauma life support mannequin, we have another one. So we have enough provision for the students to learn better using this mannequin. So at a time, students can occupy and learn togetherly the same procedure in the same lab at different places. Yes, let us go to the other side of the simulation lab. Here too we have the Nursing Pro mannequin, which again supports for multiple procedures for the students to understand, starting from head to toe assessment as well as for other procedures like perineal care, abdomen care, bruising and other things can be also learned using this Nursing Pro mannequin. And let us move on to the other side. We have a child or baby head. We can see here, this is a mannequin which helps and supports for how to deliver a baby, a pregnant mother delivering the baby. So that procedure can be taught using this mannequin, and you have a live, you can say simulator or maybe a mannequin which helps for delivering the baby. So the students will be understanding how to deliver a baby with the assistance of the instructors like they teach in the hospital. So this is a lively experience that the student gets to learn with the help of these mannequins. So till now I have explained you about the equipments and advanced things which are being equipped in our simulation lab. Yet we are further going to innovate the lab with much more OT setup and other things. Thank you one and all. We'll meet in the next video. Thank you all.